The rain hammered against the windows of St. Thomas's Hospital in London like bullets against armor, each droplet a reminder that somewhere across the channel real bullets were tearing through metal and flesh. It was September 1940, and the Battle of Britain raged overhead almost daily. Inside Ward 7, 23-year-old Eleanor Hartley moved between beds with practiced efficiency, her white uniform somehow still crisp despite 12-hour shifts that often stretched to 16. She had learned to work through exhaustion, through fear, through the constant wail of air raid sirens. But she hadn't learned to ignore the eyes of the young pilots who arrived on stretchers, their faces pale beneath oil stains and blood, their hands still trembling from gripping control sticks through impossible maneuvers. These weren't just patients. They were the thin blue line between Britain and invasion, and every single one of them knew they'd be back in the sky within days if they could still move their limbs. If you want to hear more incredible true stories from history, please hit that like button and subscribe to our channel. Your support helps us bring these forgotten heroes to light. Eleanor had grown up in Dover, where the white cliffs met the sea, where you could sometimes see France on clear days. She remembered her father, a fisherman, pointing across the water when she was 8 years old, telling her that the world was bigger than their small coastal town. Now that same stretch of water was a battlefield, and her father's old routes were patrolled by destroyers and submarines. She'd trained as a nurse in 1937 before anyone truly believed war would come again, before the word blitzkrieg entered the English vocabulary. Her instructors had taught her to dress wounds, to assist in surgeries, to manage pain. They hadn't taught her how to comfort a 19-year-old hurricane pilot who'd watched his wingman spiral into the channel that morning. They hadn't taught her what to say when Squadron Leader Morrison asked if he'd ever regain full use of his burned hands. The morning of September 15th started like any other. Eleanor arrived at the hospital at 6, tying her auburn hair back severely, checking her supplies. Bandages, antiseptic, morphine carefully logged and locked. The night shift nurse, Margaret, looked exhausted as she gave the handover. 3 new admissions overnight. 2 pilots with shrapnel wounds from flak. 1 with severe burns from a cockpit fire. Eleanor took the notes, reading the cramped handwriting that tried to reduce human suffering to clinical observations. Pilot Officer James Chen, 21, burns to hands and forearms, 2nd and 3rd degree. Flight Lieutenant Robert Davies, 24, shrapnel wounds to shoulder and back, some fragments still embedded. Sergeant Peter Walsh, 19, concussion and lacerations, observation for potential head trauma. She started her rounds with Chen. He was awake, staring at the ceiling, his bandaged hands resting on his chest like useless clubs. His parents had immigrated from Hong Kong in 1920, and he'd joined the RAF the moment war was declared, determined to prove his loyalty to a country that didn't always see him as fully British. Now he couldn't hold a spoon, couldn't write a letter home, couldn't grip the control stick of the Spitfire he loved more than he'd admit. Eleanor checked his chart, noted his temperature, examined the bandages. The burns were healing, but slowly. Too slowly for someone whose squadron was losing pilots faster than they could be replaced. "Will I fly again, Nurse Hartley?" His voice was quiet, carefully controlled. She'd learned that the quieter they were, the more afraid. She unwrapped the bandages carefully, checking for infection. "The doctor will assess you properly, but the burns are responding to treatment. You've got youth on your side, Mir Chen. That counts for a great deal." "But will I fly again?" Eleanor met his eyes. They were dark, intelligent, haunted. "I've seen men with worse injuries return to duty, but I've also seen men push themselves too hard and never recover properly. Your hands need time." "Time is exactly what we don't have." He turned his head back to the ceiling. Through the window, the September sky was gray and heavy with rain clouds. "Jerry doesn't take days off. Every hour I'm here is another hour my squadron is short 1 pilot." She finished redressing his hands using a technique she'd been experimenting with lately. Instead of the standard tight wrapping that sometimes cut circulation and made the fingers swell, she'd started leaving the fingertips slightly exposed and wrapping in a way that allowed minimal movement. It was something she'd read about in an old medical journal from the Great War, a method pioneered by a French nurse working with artillery crews who needed to return to handling shells. The article had been buried in the hospital library, dusty and forgotten, but Eleanor had a habit of reading during her breaks, hungry for any knowledge that might help her patients. "What are you doing differently?" Chen asked, flexing his fingers slightly. "That feels less restrictive than yesterday." "Just trying something new. Tighter isn't always better. Your hands need to remember how to work while they heal." She secured the bandage. "Try moving your fingers gently." He did. The pain showed in his face, but so did surprise. "I can actually feel individual fingers. Yesterday everything just felt like one big throb." "Good. That means the nerves are intact and responding. Keep doing small movements. Don't overdo it, but don't let them stiffen completely either. She moved to the next bed, where Davies was awake and trying to sit up. He was older than most of the pilots, a career RAF officer who'd flown biplanes in the late 30s and adapted to the faster, deadlier Spitfires and Hurricanes. Some of the shrapnel in his back was close to his spine, too risky to remove immediately. He'd have to carry it until the swelling went down and surgery was safer. "Morning, nurse. Any chance of real eggs for breakfast, or is it more of that powdered nonsense?" He tried to smile, but the pain pulled it into a grimace. "I'll see what I can do, but you know the answer already. Everything real goes to the front line first." She checked his dressings, noting drainage and color. "How's the pain?" "Bearable. Had worse hangovers." It was a lie, but she let him have it. Dignity mattered. "Listen, there's a briefing at Biggin Hill this afternoon. My squadron commander needs to know I'll be ready by next week." "You've got metal fragments sitting against your spine, Mr. Davies. Next week you'll still be in this bed if you're lucky." His jaw tightened. "Then someone else takes my place and probably dies because they've got 40 hours in a Spitfire instead of 400. That's not acceptable." Eleanor had heard variations of this conversation dozens of times. They all thought they were invincible, essential, irreplaceable. Sometimes they were right. The RAF was hemorrhaging experienced pilots, replacing them with boys who'd barely finished training, who didn't know the tricks and tactics that kept you alive when a Messerschmitt got on your tail. Davies had survived this long because he knew his aircraft like he knew his own body, because he could think 3 moves ahead in a dogfight, because he'd learned from mistakes that killed other men. "I'm not the one who decides when you're fit for duty," Eleanor said, "but I can tell you that rushing recovery is how temporary injuries become permanent disabilities. You want to fly again? Then heal properly first." She moved through the rest of her rounds, changing dressages, administering medications, offering words of comfort or silence depending on what each man needed. The ward was never quiet. Someone was always coughing, groaning, having nightmares in their morphine-induced sleep. The smell was a constant mix of antiseptic, blood, burnt flesh, and the peculiar metallic scent that seemed to cling to pilots who had recently been in combat, as if violence had its own odor. Around noon, Dr. Harrison made his rounds. He was in his 50s, a veteran of the Great War, and he moved with the weary competence of someone who'd seen too many young men broken. Eleanor accompanied him, providing updates on each patient. When they reached Chen's bed, Harrison examined the burns carefully. "These are healing better than I expected," he said, surprise evident. "The swelling's down significantly. How'd you wrap these?" "Modified technique," Eleanor said. "Allows for some movement while still protecting the tissue." Harrison looked at the bandages more closely, then at Eleanor. "Where'd you learn this?" "Old journal in the library. French nurse during the last war worked with artillery crews. They needed hands that could still function while healing." Harrison flexed Chen's fingers gently, watching his face. "Pain?" "Less than yesterday, sir. I can actually feel individual fingers now instead of just one big ache." Harrison nodded slowly. "Continue this method. If it keeps showing results, we might want to apply it more broadly." He moved to the next bed, but Eleanor caught a glimpse of something rare on his face. Hope. Small hope, but real. The afternoon brought new admissions. When the Luftwaffe had launched a major raid, targeting London's docks, the air raid sirens had sent everyone scrambling to shelters except the medical staff, who had jobs to do regardless of what was falling from the sky. 2 Hurricane pilots arrived with burns, 1 Spitfire pilot with shrapnel wounds to his legs, and 1 Blenheim crew member with a broken collarbone and internal injuries. The ward filled beyond capacity, beds pushed closer together, spare mattresses laid on floors. Eleanor worked without stopping, without thinking, falling into the rhythm that came from months of overwhelming need. Assess, prioritize, treat, move on. The pilot with internal injuries went straight to surgery. The burns needed immediate debridement and bandaging. The shrapnel wounds needed cleaning and careful assessment. She was wrapping the 3rd burn patient's hands when she realized she was using the same modified technique automatically. It had become instinct. "Nurse Hartley." One of the orderlies, Tom, appeared at her elbow. "Squadron Leader Chambers is here asking to speak with his pilots." She looked up. Chambers stood near the ward entrance, uniform immaculate despite the chaos outside, his face carefully neutral. He was 32, ancient by fighter pilot standards, and he commanded one of the squadrons based at Biggin Hill. Eleanor recognized him from previous visits. He always came personally when his men were wounded, always looked each one in the eye, always promised they'd have a place in the squadron when they recovered. "Give me 5 minutes to finish here," she said. Chambers nodded and waited. When Eleanor was done, she walked over. Up close, she could see the exhaustion in the lines around his eyes, the way his hands stayed carefully still at his sides, as if moving them would release something he couldn't afford to let loose. "How are they?" he asked quietly. "Chen's hands are healing. Davies has shrapnel near his spine. Walsh has a concussion, but should recover fully. The 3 new arrivals are stable." She paused. "They all want to come back immediately." "Of course they do." Chambers looked past her at the rows of beds. "We lost 4 today. 4 more planes damaged beyond immediate repair. We're cannibalizing parts from wrecks, just to keep the rest flying. I need every pilot who can grip a stick and see through a gun sight. And I need them to actually survive long enough to be useful," Eleanor said. She wasn't sure what possessed her to speak so directly to an officer, but exhaustion had worn away her usual deference. Pushing injured men back into cockpits just gets them killed slower. Chambers looked at her properly for the first time. "You're right, you're also wrong. This isn't a normal situation where we have the luxury of full recovery. We're losing. Not dramatically, not obviously, but mathematically. We shoot down 2 of theirs for every 1 of ours, but they have 3 times as many planes and 6 times as many pilots. If this continues, in 6 weeks we won't have enough aircraft or pilots to contest British airspace, and then the invasion comes." Eleanor felt cold despite the warm ward. "So what's the answer?" "I don't know. Keep fighting, keep hoping, keep looking for any advantage, no matter how small." He straightened. "May I speak with my men?" "Of course." She watched him move between beds, speaking quietly with each pilot, offering encouragement, updates on the squadron, small touches of humanity in the machinery of war. When he reached Chen, the conversation lasted longer. She couldn't hear the words, but she saw Chen's face shift from despair to something like determination. After Chambers left, Eleanor returned to Chen's bed. "What did he say?" Chen looked at his bandaged hands. "That every day I heal is 1 day closer to getting back up there. That rushing it serves no one. That when I'm ready, I'll be a better pilot than before because I'll have perspective on what we're fighting for." He smiled slightly. "And that if I'm not flying in 2 weeks, he's personally reassigning me to training new pilots because experience is too valuable to waste." "That sounds reasonable." "It is. Doesn't make waiting easier, but it helps." He flexed his fingers again, wincing but persistent. "This bandaging really does make a difference, you know. Yesterday I couldn't imagine holding anything. Today I can almost picture gripping a control stick." The seed of an idea began forming in Eleanor's mind, but she pushed it aside. She had a dozen other patients to attend to, medications to administer, doctors to assist. The idea could wait. It returned that evening as she finally sat down for a late dinner in the nurse's cafeteria. The food was barely warm, some kind of stew that had more vegetables than meat, bread that tasted of sawdust. She ate mechanically while her mind worked. Chen's comment about gripping the control stick, Harrison's interest in the bandaging technique, Chambers' desperate need for pilots who could function even while healing. "You look like you're planning to invade Germany single-handed," Margaret said, sitting down across from her with her own tray. Eleanor blinked, refocusing. "Just thinking about bandaging techniques." Fascinating topic for dinner conversation. Margaret was 42, a veteran nurse who'd worked through the last war. She'd seen everything, heard everything, and maintained a dry humor that kept younger nurses sane. Though I suppose it beats discussing the latest air raid. "How do pilots grip their controls?" Eleanor asked suddenly. Margaret raised an eyebrow. "Specifically? No idea. Why?" "Because if we're sending them back up with partially healed hands, we need to understand exactly what motions they need to perform. Maybe we can bandage in ways that protect injured areas while still allowing essential functions." "Well, that's actually clever," Margaret chewed thoughtfully. "You'd need to talk to pilots, though, get them to demonstrate." "I know." Eleanor pushed her stew around her plate. "I think Chambers would let me visit the airfield." "Only one way to find out, though you might want to clear it with Harrison first. He's particular about nurses running off on independent research projects." The next morning, Eleanor presented her idea to Dr. Harrison. He listened without interrupting, his expression thoughtful. "It's unorthodox," he said finally. "But these are unorthodox times. If you can develop bandaging techniques that get pilots back in the air safely even a few days earlier, that could make a real difference. I'll arrange clearance for you to visit Biggin Hill this afternoon. Take notes, be thorough. And Nurse Hartley, if this works, you might be saving more lives than you realize." Biggin Hill Airfield sat southeast of London, close enough to hear the bombs at night, close enough to scramble fighters within minutes of radar contact. Eleanor arrived in an army lorry that was delivering supplies, clutching her medical bag and a notebook. The base was organized chaos. Ground crews swarmed over Spitfires and Hurricanes, patching bullet holes, replacing damaged components, refueling and rearming. Pilots lounged near their aircraft, trying to look relaxed, despite the tension in every line of their bodies. The smell of aviation fuel, oil, and hot metal filled the air. Squadron Leader Chambers met her near the operations building. Dr. Harrison sent word you were coming. I've got 20 minutes before the next potential scramble. What do you need? I need to understand exactly how pilots manipulate their controls. Every motion, every grip, every adjustment. If I know what movements are essential, I can develop bandaging that protects injuries while still allowing those specific functions. Chambers studied her. That's ambitious. Come on. He led her to a Spitfire, its elliptical wings gleaming despite the wear and tear. Up close, the aircraft was smaller than she'd imagined, cramped and purposeful. Chambers climbed onto the wing, gestured for her to look into the cockpit. Control stick here, he pointed. Grip it with your right hand, thumb here on the gun button, this finger on the cannon button. You're not just holding it, you're making constant micro-adjustments. Bank left, pull back, push forward, rudder inputs with your feet. Your hand never stops moving in combat. Eleanor made notes, asked questions, watched as Chambers demonstrated grips and movements. Other pilots gathered, curious, adding their own insights. The throttle quadrant on the left required firm, precise movements. The mixture control needed delicate adjustment. The radio button on the stick needed to be reachable without shifting grip. Burns are the worst, one pilot said. He was young, maybe 20, with healing scars on his hands. Can't grip properly, can't feel the stick, overcorrect everything. I nearly spun in twice before I was really ready to fly again. What if your fingers were individually mobile, but your palms were supported? Eleanor asked. Would that help? Maybe, if I could actually feel what I was touching. The problem with standard bandaging is everything goes numb, you know? Can't tell if you're gripping hard enough or about to crush something. Eleanor filled pages with notes, sketches, observations. She watched pilots climb in and out of cockpits, noticed how they braced themselves, where they put pressure, what movements were instinctive. By the time the air raid siren sent everyone scrambling, she had a clear picture of what was needed. The scramble was both terrifying and fascinating. Pilots sprinted to their aircraft, ground crews yanking wheel chocks away as engines roared to life. Within 3 minutes, 12 Spitfires were airborne, climbing hard toward incoming raiders. Eleanor watched them disappear into the gray sky, then spent the next 2 hours with the ground crews, learning about the mechanical stresses on control surfaces, the forces pilots had to overcome. When the squadron returned, one Spitfire was missing. Another landed with fabric shredded from its wings, bullet holes stitching a line across the fuselage just behind the cockpit. The pilot who climbed out was shaking, whether from adrenaline or cold or fear, Eleanor couldn't tell. Probably all three. All there. Back at the hospital that evening, Eleanor worked late into the night, developing new bandaging protocols. She pulled every medical text she could find, consulted with Harrison, experimented on herself to understand how different wrapping techniques affected mobility and sensation. The key was selective support, rigid protection for damaged areas, flexible support for regions that needed movement, and minimal interference with nerve sensitivity. She started implementing the techniques the next morning, beginning with Chen. His burns were healing well, new skin forming pink and tender beneath the damaged layers. She wrapped his hands in a pattern that immobilized his palms where the worst burns were, but left his fingers individually mobile, each wrapped just enough to protect without restricting. Try it, she said. Chen moved his fingers carefully, then with more confidence. It's like having hands again, not normal hands, but actually functional hands. Over the next week, she refined the technique on every pilot who came through the ward. Davies, with his back wounds, got bandaging that supported his shoulder without restricting his arm mobility. Walsh, recovering from his concussion, got wraps on his bruised ribs that allowed full breathing, but prevented him from twisting too far. Each patient became a study in functional anatomy, each bandage a custom solution. Word spread. Pilots from other squadrons started requesting transfers to St. Thomas's, specifically because of the flying bandages that got them back in the air faster. Harrison presented Eleanor's techniques at a medical conference for military hospitals. Within 3 weeks, nurses across southern England were learning her methods. Chen returned to duty after 12 days, the fastest recovery from severe hand burns anyone at the hospital had seen. He sent Eleanor a letter a week later, scrawled in shaky handwriting but legible. Dear Nurse Hartley, I shot down 2 Me-109s yesterday. My hands worked exactly when I needed them to. I owe you my life, not because you healed my burns, but because you gave me the ability to defend it. With gratitude, James Chen. The letter was pinned to the notice board in the nurses' station, where everyone could see it. It was joined by others. Davies, back flying after 3 weeks instead of the expected 6. Walsh, cleared for duty with no lingering symptoms. A hurricane pilot she'd treated for shrapnel wounds, writing to say the bandaging had let him maintain his strength training during recovery, so he didn't lose muscle mass that would take weeks to rebuild. Eleanor kept every letter in a small wooden box her father had made years ago, before the war, before everything changed. She read them during her breaks, especially on the difficult days when patients didn't make it, when the surgery went wrong, when the bombs fell too close. The letters reminded her why she kept going. One particular morning in early October brought a new patient who would challenge everything she'd learned. Flight Lieutenant Thomas Brennan arrived unconscious, carried in by 2 orderlies who'd transported him from a forward aid station. His file told a story of remarkable bad luck. Shot down over the channel 3 weeks prior, rescued by a fishing boat, severe burns to both hands and his right leg, infection that had nearly killed him twice, and now transferred to London for specialized treatment. Eleanor examined him carefully once he was settled. The previous bandaging had been competent but standard, wrapped tight to control bleeding and protect the wounds. Beneath the gauze, his hands were a mess of healing and still raw tissue, the kind of damage that typically meant months of recovery if function returned at all. His leg was better, the burns there less severe, but still concerning. Dr. Harrison joined her at the bedside. He's got family pulling strings to get him the best treatment. Father's something in the War Office, but honestly, I'm not sure we can give him much beyond what he's already received. Those hands might be too far gone. Let me try, Eleanor said quietly. Give me 2 weeks with him. Harrison looked skeptical but nodded. 2 weeks, but if there's no improvement, we'll have to consider the likelihood that he's done flying. Brennan woke that evening, groggy from morphine and disoriented. Eleanor was checking his chart when his eyes opened. They were blue, sharp despite the drugs, and immediately focused on his bandaged hands. How bad? His voice was rough from disuse. Bad enough that you're here instead of at a forward station, but not necessarily beyond recovery. Eleanor set down the chart. I'm Nurse Hartley. I'll be managing your treatment. Brennan, Tom. He tried to move his fingers and grimaced. Can't feel much except pain. That's not good, is it? It's actually better than feeling nothing. Pain means nerves are intact and responding. She pulled a chair closer. I'm going to unwrap these and take a proper look. It'll hurt, but I need to assess what we're working with. The process took nearly an hour. Brennan bore it with gritted teeth and occasional sharp breaths, but didn't cry out. Eleanor worked methodically, documenting every burn, every area of healthy tissue, every region where sensation seemed preserved. By the end, she had a clear picture. The damage was extensive, but there were islands of less affected skin, areas where nerves still functioned properly, spaces where careful bandaging could provide support without cutting off circulation. Verdict? Brennan asked when she was done applying antiseptic and preparing new bandages. You'll never play piano professionally, Eleanor said, but I think we can get you back to gripping a control stick. It'll take work. You'll need to exercise your fingers daily, even when it hurts. The bandaging I'm going to apply is different from what you've had before. It'll feel less secure, more mobile. That's intentional. Whatever it takes. His jaw was set in a line she'd seen before on other pilots. Determination bordering on obsession. I've got 12 kills. My squadron needs me. Over the following days, Eleanor implemented her most ambitious bandaging protocol yet. She wrapped each finger individually, using layers that provided compression without restriction, leaving the fingertips exposed to maintain sensation. The palms got additional support where the burns were deepest, but she left channels where healthy skin could breathe and flex. For his leg, she created a pattern that protected the burns while still allowing the knee to bend, the ankle to flex. The exercises were brutal. Eleanor would visit Brennan's bed 3 times per day, guiding him through movements designed to prevent scar tissue from permanently limiting mobility. Grip strength exercises using rolled gauze, finger flexibility drills with small wooden pegs, fine motor control practice with buttons and coins. Each session left him sweating and pale, but he never complained, never asked to stop. Other nurses noticed. Margaret pulled Eleanor aside after a week. You're spending a lot of time with the new pilot, more than the others. His case is complicated. The injuries are severe but potentially recoverable with intensive treatment. Eleanor kept her voice professional. And nothing. He's a patient who needs specialized care. But even as she said it, Eleanor knew it wasn't entirely true. There was something about Brennan's quiet determination, his refusal to surrender to despair, that resonated with her. He reminded her of her father, who'd faced down storms at sea with the same stubborn courage. By the 10th day, Brennan could grip a pencil well enough to write shaky letters. By the 12th, he could button his own shirt slowly and painfully but independently. By the 14th, he demonstrated enough hand function that Dr. Harrison revised his prognosis from unlikely to fly again to possible return to limited duty. I need full duty, not limited, Brennan said when Harrison explained the assessment. Then keep improving, Harrison replied. Nurse Hartley's techniques are giving you a chance most burn patients don't get. Don't waste it by pushing too hard, too fast. Eleanor was changing his bandages that evening when Brennan spoke quietly. "Why do you do this? The extra hours, the specialized treatment? You could just follow standard protocols and go home at the end of your shift." She considered the question while working. "Because standard protocols were written for peacetime recovery. We're not in peacetime. We need better solutions, and if I can find them by paying attention and trying new approaches, then that's what I should do. Besides, every pilot I get back in the air is one more chance to stop the bombers before they reach London. That means fewer casualties in the wards, fewer children killed in their homes. It's all connected." "You sound like you're fighting the war as much as we are, just with bandages instead of bullets." "Maybe I am." Eleanor secured the last wrap. "Try the grip exercise." He did, his face showing the effort and pain, but his fingers closed around the rolled gauze with visible strength. "Better than yesterday." "Much better. At this rate, you'll be pestering Dr. Harrison for discharge papers within the week." She was right. 9 days later, Brennan was cleared for return to limited duty, with strict instructions to continue the exercises and return weekly for assessment. He stood by his bed in his uniform, properly fitted again now that he could dress himself, and extended his right hand to Eleanor. "Thank you, not just for the medical treatment, but for believing I could get back to this." His grip was firm, warm, alive. "Just promise me you'll be careful up there. I'd hate to have wasted all this effort just so you can get shot down again." She meant it as a light comment, but her voice caught slightly. Brennan smiled. "I'll do my best, though Jerry doesn't always cooperate with our plans." He hesitated, then added, "When this is over, when we've won, I'd like to take you to dinner. Somewhere nice where we can eat real food and pretend the war was just a bad dream. If you'd be interested?" Eleanor felt warmth spread through her chest, unexpected and slightly frightening. "When we've won," she agreed. "I'll hold you to that, Flight Lieutenant." He left the next morning, walking out of the ward under his own power, his hands still bandaged but functional. Eleanor watched him go, feeling the peculiar mix of pride and anxiety that came with every pilot she sent back to the sky. She'd done everything she could. The rest was up to him, his aircraft, and the random chances of combat. But the real validation came in late October when Chambers returned to the hospital, this time with Air Vice Marshal Park, who commanded all fighter operations in southeastern England. They found Eleanor on duty, still moving between patients with her practiced efficiency. The visit came without warning. Eleanor was in the middle of teaching a new nurse, Sarah, the proper technique for wrapping a pilot's burned forearm, when the orderly announced that senior officers were requesting to speak with her. She finished securing the bandage, gave Sarah quiet instructions to continue with the next patient, and walked to meet them, acutely aware of how exhausted she must look after a double shift. "Nurse Hartley," Park said without preamble, "your bandaging techniques are having measurable impact on pilot availability. Squadron Leader Chambers tells me several of his pilots are back in action weeks earlier than standard recovery timelines would predict." Eleanor felt suddenly self-conscious, standing before such high-ranking officers. "I was just trying to help them heal effectively, sir." "You did more than that. You identified a problem no one else was looking at. Medical treatment has always focused on complete recovery before return to duty. But in wartime, we need functional recovery first, complete recovery later. Your methods bridge that gap." He pulled out a folder. "I'm authorizing the creation of a specialized training program for nurses at all RAF medical facilities. You'll be developing the curriculum and training the instructors." "Sir, I'm not qualified to—" "You're the only person who is qualified. You did the research, developed the techniques, proved the results." Park's expression softened slightly. "This isn't punishment, Nurse Hartley. This is recognition that you found something valuable, something that will save lives." Eleanor felt the weight of responsibility settle on her shoulders. When would this begin? "Immediately. We're losing too many experienced pilots to extended recovery times. Every week we delay is another week we're not operating at full efficiency." Park glanced at Chambers. "Squadron Leader Chambers has volunteered to provide you with access to active squadrons for continued research and training. You'll split your time between hospital work and field instruction." The program launched in November. Eleanor spent 2 weeks at each major hospital teaching nurses her techniques, explaining the reasoning, demonstrating on patients. It was exhausting, traveling while still maintaining her regular shifts at St. Thomas's, but it was also thrilling. She saw nurses grasp the concepts immediately, saw them start experimenting with their own modifications, saw the techniques spread and evolve. At RAF Hornchurch, she met a nurse named Catherine who'd been working with pilots suffering from frostbite in their extremities from high-altitude flights. Together, they developed a variation of Eleanor's bandaging that improved circulation while still protecting damaged tissue. At Tangmere, another nurse named Dorothy showed Eleanor how slight modifications to the palm wrapping could better accommodate the specific grip required for hurricane throttles versus Spitfire controls. Each visit brought new insights, new refinements. Eleanor documented everything in detailed notes that grew into a comprehensive manual. Dr. Harrison helped her organize the information into clear instructional chapters, complete with diagrams and photographs. The manual was distributed to every military hospital in Britain by Christmas, with additional copies sent to Commonwealth forces in Canada, Australia, and New Zealand. But the fieldwork proved most valuable. Eleanor spent 3 days at North Weald, watching pilots fly training missions with recently healed injuries, noting how they adapted their techniques, where the bandaging worked well, and where it created unexpected problems. She observed that pilots with hand injuries subconsciously shifted their grip patterns to avoid pain, which sometimes led to slower reaction times in combat situations. This insight led to a new protocol, occupational therapy. Alongside the bandaging, retraining muscle memory so pilots could maintain their combat effectiveness even while healing. The winter of 1940 brought new challenges. The Blitz intensified through November and December, with German bombers targeting London almost nightly. St. Thomas's Hospital itself was hit twice, though thankfully without casualties in Eleanor's ward. She grew accustomed to working through air raids, continuing to change bandages and administer medications, while the building shook from nearby explosions. The patients who could walk would help move those who couldn't to the reinforced basement shelters. Those too injured to move stayed in their beds, and Eleanor stayed with them, calmly continuing her work as if bombs weren't falling all around them. One particularly bad night in mid-December, a bomb struck close enough to shatter windows throughout the ward. Glass rained down on patients and staff. Eleanor was thrown against a medicine cart, her shoulder taking the impact hard enough to leave her gasping. But there was no time for pain. 3 patients were bleeding from glass cuts. One had been thrown from his bed and might have re-injured his healing back, and the cold December air was rushing in through the broken windows. "Margaret!" Eleanor called out, already moving toward the nearest injured patient. "Get blankets for everyone. Sarah, help me with Watson. He's bleeding from his arm." They worked through the night, treating new injuries, covering broken windows with whatever materials they could find, keeping patients warm and as calm as possible while the raid continued overhead. By dawn, when the all-clear finally sounded, Eleanor had been on duty for nearly 20 hours straight. Her shoulder throbbed, she had glass cuts on her hands and face, and she was so tired she could barely stand. Dr. Harrison found her sitting on the floor of the supply closet, taking inventory of their dwindling bandage supplies. "Nurse Hartley, you should go home. You're injured and exhausted." "I'll go when the shift ends." Eleanor made another mark on her clipboard. "We're low on sterile gauze and completely out of the elastic wrapping I use for the specialized bandages. Can we requisition more?" "I'll put in the request, but supplies are tight everywhere. The factories can't keep up with demand." Harrison sat down beside her, wincing as his own old wounds protested. "You can't save everyone by working yourself to death." "I know, but I can try to save more by working harder than I otherwise would." "That's not sustainable. You're too valuable to burn out." He paused. "I'm recommending you for commendation. What you've accomplished with these bandaging techniques, the training program, the manual, it's exceptional work, the kind that changes how we practice medicine." Eleanor felt embarrassed by the praise. "I was just paying attention to what the patients needed." "That's exactly what makes it exceptional. Most people don't pay that kind of attention. Most people follow the established protocols and never question whether there might be a better way." Harrison stood slowly. "Go home, Nurse Hartley. That's a direct order. Rest for at least 12 hours. The war will still be here when you return." She did go home, to her small flat in Lambeth that she shared with 2 other nurses. The windows there were also broken, covered with cardboard and tape. The flat was cold, the furniture was sparse, the constant noise of the city at war made real sleep difficult. But it was hers, and for 12 hours she let herself rest, let someone else carry the burden. When she returned to the hospital the next afternoon, there was a letter waiting for her. The return address was RAF Biggin Hill, and the handwriting was familiar. Thomas Brennan had written, "Dear Eleanor, I hope it's appropriate to use your first name, given that you saved my hands and possibly my life. I wanted you to know that I flew my first combat mission since returning to duty yesterday, shot down a Dornier bomber before it could reach London. My hands worked perfectly, no hesitation, no loss of grip strength. Everything you told me about healing while maintaining function proved true. I also wanted you to know that the dinner invitation stands, war or no war. If you're ever free and willing, I know a little restaurant in Soho that somehow still has real butter. Yours gratefully, Tom." Eleanor read the letter 3 times, feeling something warm and hopeful bloom in her chest despite everything. She tucked it into her pocket and returned to work with renewed energy. By December, the impact was becoming clear. Pilot recovery times were down across the board. More experienced pilots were staying in action. Fewer partially healed injuries were becoming permanent disabilities. It wasn't enough to turn the tide of the war by itself, but it was one more small advantage in a desperate struggle for survival. Chen visited her in December on leave before Christmas. He looked older than his 21 years, with new lines around his eyes and gray threading his black hair. But he was alive, and when he shook her hand, his grip was strong. 14 confirmed kills now, he said. Every one of them possible because I could grip my controls properly, because you figured out how to let my hands heal and work at the same time. I just wrapped bandages differently. You did more than that. You changed how we think about recovery. Every pilot knows now that getting injured doesn't mean sitting in hospital for months. We can heal and fight. That changes everything psychologically. He paused. You saved a lot of lives, Nurse Hartley, not just mine. Every pilot who got back in the air sooner, every German bomber they stopped, every British life saved because those bombs didn't fall. That's your doing. Eleanor felt the weight of those words, the responsibility and the strange pride. She'd never thought of her work in such grand terms. She was just a nurse, doing her job, trying to help where she could. But maybe that was enough. Maybe small innovations, applied consistently, really could change outcomes. The Battle of Britain officially ended in late October, though scattered raids continued through the winter. The Luftwaffe hadn't achieved air superiority. The invasion hadn't come. Britain had survived, held by chains of radar stations, by factories working around the clock, by civilians enduring the Blitz, and by the young men and women who kept the aircraft flying and the pilots alive. Eleanor continued her work at St. Thomas's through 1941, through the continued bombings, through new waves of wounded as the war expanded. Her bandaging techniques became standard practice, taught in nursing schools, included in medical manuals. She received commendation from the Royal College of Nursing, a personal letter of thanks from the Air Ministry, and a small ceremony where Air Vice Marshal Park presented her with a certificate of appreciation. But the recognition she valued most came from the patients, the pilots who walked out of her ward on their own feet, who returned to duty weeks earlier than expected, who wrote letters from bases across England, North Africa, and eventually Europe as the war turned. Each letter was a small victory, proof that caring and creativity could make a difference even in the darkest times. The rain continued to fall on London, washing blood from streets, filling bomb craters, running down hospital windows. Eleanor Hartley stood at those windows sometimes, during rare quiet moments, watching the sky. Somewhere up there, men she treated were flying, their hands wrapped in bandages she'd designed, their lives extended by techniques she'd developed. It wasn't magic. It wasn't miracle. It was simply someone paying attention, seeing a problem, and refusing to accept that nothing could be done. In the end, that might have been the real trick. Not the bandages themselves, but the willingness to question assumptions, to try new approaches, to believe that one person working carefully could create ripples that spread far beyond anything they initially imagined. The war would continue for years yet, with all its horror and waste and necessary sacrifice. But in the small corner of it that Eleanor Hartley could influence, young pilots flew with steadier hands, and that made all the difference.